So, Manny, we covered a lot of information about different cannabinoids, and I thought that was a pretty good overview of the different products and how they can help people. Let's jump into some questions that were asked. Oh, actually, better yet, let's talk about something that's even more important. At Surterra, you have some promotions coming up for 420, right?
Absolutely. Most people are aware 420 is the coup de grace of the dispensaries, if you will. That's when all the big sales and new products usually come out and so forth. And as you can see on the slide, Soterra is starting off strong with our 420 starting this week. And you can get great deals starting now. We're going to have extended hours on 420, which is this Saturday. And whether you are a first time patient with us or you've shopped with us before, if you shop on 420, you'll get entered into some great giveaways. As you can see there's a lot of goodies as far as the express bomb, the spoon, which is a little glass pipe, the grab taster, the dad hat, and so forth. So come shop with us, come talk to us, come have a consultation. We will be pretty busy that day particularly, so you might want to set some time aside. But otherwise, we'll be happy to speak with you.
Yeah, I do want to point out to a lot of folks the reason we show this is because although we do the video, we talk about the theory, not just the theory, we talk about the science behind medical cannabis. What we want to do is we want to show you that there's a place you can go literally today, tomorrow, to be able to get the products you need to help provide the relief that you're looking for. In other words, this isn't a maybe it's going to happen. You can go into Surterra, you can ask for a consultation, and they will actually help you choose the products that are best for you. Is that correct, Manny?
100% correct. And we also have private consultation rooms within the dispensaries. So if you value your privacy and want to discuss with us privately, we can make that happen. Otherwise, whatever's most comfortable to you. And did want to add one last part to that as far as the slide and the giveaways. If you're shopping with us and you're not already a loyalty member, it's real simple to do. You could get there from our website. You can download our app through the App Store or the Android and become a loyalty member, because for every dollar you spend, you get some points or a point. And once you accumulate so many, 500, you can stack a 10% discount. We do understand that these things can get expensive and it can get kind of frustrating when it comes to that point. So we want to help out any way we can.
Well, I think your frequent flyer program, in other words, your frequent point program, I think is great. Also, I want to point out that I get your emails, and please sign up for the emails because you do a great job on a weekly basis providing specials on a number of products.
Absolutely. We'll even have some doorbusters, particularly for this 420 weekend. But we always have sales going on. We're always trying to accommodate our demographics, depending on where you're at in Florida, and make
Sure.
sure that we can get you the medicine that you need and want.
Great. Cool. Let's jump into answering some questions because I think there's a lot of questions that come up. People have a lot of questions on cannabis. So the first question is, my wife suffers from fibromyalgia and from a past auto accident, chronic lumbar pain. Which cannabinoids would benefit her? Manny, this is right up your alley.
Yeah, absolutely. I'd be glad to assist, and I'm sorry to hear what she's suffering from. That can be painful. The one thing I would like to point out and want people to remember is that you won't necessarily go shopping for one particular cannabinoid or one particular terpene. As described in the presentation, it's considered the entourage effect. So you want to find a product that has not only the cannabinoids but also the terpenes and the right ratio, if you will, as far as CBD to THC ratio, to consider whether she needs to be clear-minded. Is she going to stay at home? Can she tolerate the euphoric effects? So some of the products I would recommend from Surterra starting off would be from our wellness line, because it's consistent. You know, if it works, it'll continue to work. And then you have a recipe, your terpene and cannabinoid profile to base any of future products off of. And one of those products would be our one-to-one Soothe product. We have it in a tincture, which could be sublingual. We have it in a vape, which could be inhaled. We have Theragels, but they kind of look like vitamin B capsules. So those are to be ingested and swallowed down. And then we also have a topical that would work great for that lumbar pain. It's called the one-to-one fix. And that would be the baseline. That's coming with high caryophyllene as a terpene. You're getting CBD and THC at a one-to-one ratio, so it's a 50-50. And then you're getting other terpene profiles within that that's going to give you that full entourage effect. And then you can also use it topically or in tangent with a vape or a tincture or oral or edible as well.
I think it's important to point out that whatever product that you're looking for, make sure you have CBD in it. It's a ratioed product. You'll hear on a ratioed product, you'll hear something like 4 to 1. What does that mean? It means it has 4 parts CBD, 1 part THC, or 1 to 1, 1 part CBD, 1 part THC. But the CBD is important because of the neuroprotectant capability to help with not only the fibromyalgia, but also to reduce the inflammation with the lumbar pain.
Absolutely, 100% agree with that, Mark.
Yeah. Let's jump on to the second one, which is a good question, by the way, this next question. I'm concerned that medical marijuana is increasing my heart rate by at least 30 beats per minute. Is this normal? Using cannabis can increase your heart rate. Manny, do you want to take this one?
Yeah, I'll piggyback off of you if you don't mind, Mark.
Okay, yes. The answer is because cannabis it works with your endocannabinoid system, it's distributed through your body by the bloodstream. So when you're using cannabis, it's being sent throughout or to the parts of your body that need to have that particular relief by the bloodstream. Now, it will increase your, initially, when you first take it, it will increase your heart rate. And then over a period of time, what scientists have found out is after about 30 to 45 minutes, your heart rate will actually go back to normal. Why is it doing that? Because it's your heart that's working to be able to produce those endocannabinoids, or excuse me, to distribute those endocannabinoids. And what it does is it actually kind of awakens the whole circulatory system to make sure that they get sent and distributed properly. Now, when you have a heart condition, it is really important that you work with your medical marijuana doctor because you want to make sure that you have the right cannabis associated with also your heart medications, formal heart medications, to make sure that you do get into a situation where your heart will then go back to normal after about 30 minutes, and you're not going to be affected by the normal medications that keep that heart rate up. Your thoughts, Manny?
Yeah, I was couldn't say it more eloquently than that. The only thing I would add, Mark, is that you also would want to look at the terpene profiles.
Right.
In the sativa category, particularly alpha pinene along with limonene paired up may induce that anxiety, paranoia, heart rate more significantly than other strains or chemovars. And then the method in which you are taking your medication may also play a role.
Right.
So come in, have that consultation. We can kind of dial it in a little bit easier. And again, always remember to go start low, go slow.
Right. And again, if you do have a heart condition, you can use medical cannabis. It's important to coordinate between the pharma drugs and the cannabis drugs to make sure that you're doing something that lets your body function normally. And that's what's really, really important. Next question is, I have allergies to eastern seaboard trees. Would I be at risk for allergies to pinene? I think a lot of the allergies come from the pollen, but I don't think pinene itself is going to cause a problem. Your thoughts, Manny?
I don't believe so either. Pinene in particular is one of the most abundant terpenes in the world. And so it's not going to be isolated to one seaboard or the other. I don't believe there would be, but again, I'm not a medical professional. I can only suggest that they could be a risk. Of course, there's a possibility, but
Right.
the likelihood of it is not very high, if at all.
Yeah, because what's happening is a terpene is it's being introduced into your body via the cannabinoids, and so it's being distributed right to that receptor from the cannabis. The pollen is what causes a lot of problems with eastbourne trees, and there is no pollen in the way cannabis works inside your body. So I don't think you'll be at risk for that. But then again, I do caution everybody: every person's body is different. Just like with alcohol, just like with caffeine and coffee, you really have to know what your tolerance level is. I mean, I have friends who have one drink and they're done for the night, and I have other friends who candidly drink the whole bottle and they're just getting started. I would actually monitor that just to be safe. I wouldn't necessarily just assume it, but I would really walk into this assuming that it will not cause a problem, but monitor it and stay in touch with both your dispensary and your medical marijuana doctor if you do have any problems that are out there. Next question
Also,
is, go
if
ahead,
I may,
Manny.
Mark, I was just going to suggest most likely pinene is not found in high quantities in cannabis products.
Right.
You may find it in higher quantities in the sativa category, but again, it's not going to be in such numbers that should have that effect.
Sure. Good question here, Manny, which I think falls into your category. What are your perspectives on why few dispensaries choose not to publish COAs, especially terpenes and family genetics? It's related to another question that came up What can patients do to encourage growers and retailers to list terpene profiles online so we can select appropriate products? Manny, do you want to start with this one, or you want me to take it?
Absolutely. I'll jump on this one. That's a great question. I don't believe it's so much that they're choosing not to, it's the logistics that go behind it. So what we need to try to remember is that cannabis is a live product. It's a plant, and it changes from batch to batch. So it's not like those DOAs stay completely consistent. Even a slight variation in 0.0001%, we would have to print off a whole new COA. So to the logistics of having that done in a timely manner to have it posted online is significant. And that also plays into the next question, to have the terpenes list online. I know some dispensaries are doing it. Surterra, we are working to get that available. But again, to consistently have automation that will communicate between software in order to have that updated appropriately between batch to batch, because of that 0.00001%, is a significant task. So it's not that we're trying to keep it away from the public. You come in, you ask for it, we'll produce that COA upon request. We'll print it out for you. If not, discuss it with you. So it's a work in progress. And in the state of Florida, we're vertically integrated. So everything has to be done in-house from seed to sale, to include everything in between, not just the plant itself, but everything that we do in order to get that product out to the consumer. So it's
I think
just
it's more,
about
I
the
think it's not a matter of dispensaries don't want to publish it. I think it's a matter of just especially the third-party tests that are done, getting that information online and getting it into the website is a bit of a challenge. I know, you know, I've been working with Surterra for a while, and I know this is something that you're working very hard at doing. You will give people COAs, they are available, and I think getting them online is, I think, your next challenge. And that's more of an IT issue than it was anything else. Now, I will say that some dispensaries don't want to publish the COAs because they have no terpenes in their product. And that's a whole different issue, and I won't going to get into that. But the whole area here is check the COAs. A quality medical marijuana dispensary, especially here in the state of Florida that's licensed, will be able to provide you at least printed COAs. Is that correct, Manny?
Yes, absolutely. And then one last tidbit on the family genetics of things. Also got to remember these are secret recipes, so to speak. One purple punch at one dispensary is not going to be the same purple punch at another because of that secret recipe and the way it's grown. So there are some limitations as to what will be published. However, terpene profiles are not part of that, at least not the complete terpene profile. And we will be making that available hopefully soon.
Right. The next question is a great question, and one I definitely want to, I'm gonna have you help me answer it, Manny, but I want to really address because this has a bee in my bonnet. It's been in the news that there's a possible link between heart problems and smoking marijuana for long-term use. What have you seen on this topic? And that's a related question. What are the long-term effects of smoking pot in your lungs? I want to address something here. CNN, there was a study that was done in what they call in the medical research, the AMA, a medical research journal, that was actually a pharma company went to a firm and said, I want you to do a study that shows that cannabis causes or can have heart problems. Okay. And they produced that study. You go to a scientist, that's what they'll produce. That study has since been debunked. That article that was put in the Medical Association has been withdrawn. And in fact, it has been completely debunked because the research that was done was not done properly, was not done with the right information, and did not come to the right conclusion. Cannabis does not cause heart problems. Cannabis can, in fact, help with heart problems. But because cannabis is used by the body to be distributed through the bloodstream, you have to be very careful about what the gentleman brought up, or the question that came up earlier, to make sure that your blood pressure stays within the bounds and that you can, in fact, work with that. A lot of medications that are for the heart do increase your heart rate. And so what you don't want to do is you don't want to aggravate that particular issue, because what you're trying to do is you're trying to activate and you're trying to wake up the heart to do the job that it's really supposed to do. Now, the question about long-term use of cannabis and heart conditions, this is where that study really broke down, because they really didn't have the proper study or patients to be able to show that. Now, I'm going to address the issue of long-term effects of smoking on the lungs. And really, Manny, what we're talking about is when we use the word quote unquote smoking, there's two different kinds. There's one where you actually burn material, like with tobacco, then you smoke a cigarette. And then there's also vaping, where you're actually taking that actual cannabis product, steaming it, and being able to get the medical benefits out of that. I think that there's a major difference between it, because anytime you have anything that you're lighting up and you're putting burnt material into your lungs, it's not good, whether it's cannabis or not cannabis. That's why I really recommend vaping in a lot of cases. However, smoking cannabis or being able to use that is a lot safer than smoking cigarettes. Your thoughts on this, Manny?
I agree 100%. And to those studies, I followed those studies the same way, and I'm in alignment with you on that as well, Mark. But as far as smoking and vaping cannabis, there is a significant difference. And there's also another caveat, is that a lot of people will start seeing, if not already, different types of rolling papers and materials to put your flower in. And you got to be cautious with that too, because, and that's the reason why things are more expensive at a dispensary, is because in order to be sold at a dispensary, it has to pass a test in order to be for medical use. And therefore, we have to buy from appropriate third parties or
Right.
otherwise. So if you're buying it from a smoke shop or a gas station, all that, it can have certain bleaches and other materials in it. And then, of course, when you combust it and put a flame to it, you're getting carcinogens and other burnt materials into your lungs. Hence, it has potential for danger. Um, but at the same time, it's not adulterated either. It's not like tobacco where it has all these other different chemicals in it. And again, to point out the COAs, you'll see if there's any heavy metals, pesticides, mycotoxins, residuals, any filth or byproduct material after the product. So that's why that liability is so important. And in vaping flower, you're not combusting it, and there are devices out there where you can heat it up. It'll get to a certain temperature and vibrate, letting you know when it's ready. And you draw on it very lightly, and the vape is not going to be as thick that comes out, but the effect is still going to be there. Hence, you're not getting so much raw material into your lungs, and it's significantly safer.
Right. Significantly safer. I think, first of all, let's back up. If you are smoking with burnt material over a long period of time, it's going to be detrimental to your lungs. Forget if it's cannabis or not. That's why people who smoke cannabis, who've been smoking joints for a long time, do in fact potentially are doing some harm to their lungs because they're putting burnt material in there. However, for at least the last decade, there are devices called dry herb vaporizers that allow you to take that cannabis, put it in a device, be able to get the full medical benefits out of cannabis without the burnt materials and with a minimal impact on your lungs. Is that correct, Manny?
Absolutely, 100%. And then also, one thing I would like to dismiss is holding your breath. Well, a lot of people, that's very old school, old mentality, is when you inhale, you hold your breath as long as you can, and then you exhale. There's really no need for that. You're actually wasting a lot of product and you're irritating the lungs if not having that vape recondense, which is safe as long as you're getting it from a dispensary where there's liability because our body is able to absorb that. But if you're smoking, you're really irritating your lungs even more by holding your breath. All you need to do is inhale. The depth of your breath is going to dictate the effect, and then slowly exhale while trying to breathe normally. And you get more gas exchange with oxygen and the material left in your lungs, giving you more of a significant effect.
That's a great tip, Manny. That's a really great tip. So, bottom line, let's answer this question directly. There is some news that's out there. It's been completely debunked. Long-term smoking of any burnt material in your lungs will hurt your lungs. It's recommended that if you're to look at smoking cannabis, use vape devices because it's going to be a lot less impact on your lungs. And in fact, they have shown that over a period of time, vaping devices have very little effect on your lungs. Although it has an effect, it has a lot less effect than if you're smoking with burnt materials. That's safe to say, Manny?
Absolutely, I agree.
Okay, let's run on to the next question. What are the best cannabinoids for nerve pain and numbness? Manny, that's right up your alley.
Yeah, that's a great question. Nerve pain is, I always go with any type of pain, really, B-caryophyllene and CBD to start off with. Depending if you're using it topically, if you're inhaling it or ingesting it, it's going to make a difference. Also, a lot of people who deal with pain, especially nerve pain or extreme chronic pain, will typically go for the THC first because it does distract from that pain. But always remember to maintain implementing CBD and those scales will tend to turn almost like a seesaw where you'll go back and forth, sometimes more CBD, sometimes more THC. And that's because CBD is really the star of the show. It really binds with your CB2 receptors in your peripherals. And then that B-caryophyllene really binds with CB2 receptors as well, almost like a cannabinoid, though classified as a terpene. So you have your topical route, you have your oral route, your inhalation, sublingual, and then of course you could smoke or your edible route as well.
Right. Here's another question. Here's the next question that is, by the way, good answer. That's very interesting. What is the process for distillation for creating a botanical vape versus the process for creating the FSO vape cartridge? Now, my understanding, Manny, is the FSO vape cartridge is a very thick. I'll call it a liquid, but it's really more of a very thick material. Is that correct?
It is, to your point, and there is no FSO vape cartridge. I know I want to express that FSO full spectrum oil, also known as Rick Simpson oil, is not to be inhaled. It can actually promote inflammation of the lungs and be very damaging. FSO is to be used topically and or orally or ingested only. Please, please, please do not inhale FSO. The reason is, and to answer the question, is the process of distillation for botanical vapes. There's different methods. You have CO2, you have ethanol, but long story short is that all that is evaporated out, and you're left with a concentrate of certain terpenes and or cannabinoids. Whereas with the FSO, you're getting a full plant extraction. You're getting the lipids, the chloroform, the cannabinoids, the terpenes, everything that's on that plant, you're getting in a tube, which is why you don't want to inhale it. It's not the best practice, and I highly, highly suggest that you don't ever do that.
Right. And again, I'm going to again emphasize what you're saying. FSO is not for smoking. There's no vape cartridges I know of, but they do make distillate cartridges for botanical vapes, especially when you get the rosins and the resins. And I say that because in one case, you're actually freezing the plant and getting the trichomes off. In another case, you're using a pressing process. Is that correct?
Yeah, and so the freezing process is more when you're going to see live products, live rosin vapes, and so forth. Then you have CO2, which is heat and pressure, and CO2 with that pressure liquefies and then it re-evaporates. So there's very many different processes, and depending on that process, it go into the price point as well.
Right.
Um, the one thing I also want to clarify is I think the confusion that comes with the FSO vape cartridge is that we do sell FSO in a syringe type device.
Right.
And the reason that's important is because we also sell our distillates in a syringe type device, which you can vape, you can dab, you can refill cartridges and so forth. And I want to make sure that even though it comes in that device, that syringe looking device, FSO is not to be dabbed, not to be inhaled whatsoever.
Right. Good point. Next question is a good question. What the best terpenes for cancer, both prostate and bone? We've done a lot of work on this. Do you want to take this on? Or you want me to take that on, Manny?
By all means, please, Marc.
Okay, I think when we're looking at the best terpenes for cancer, what you're really looking at doing is a couple things. One, you want to shrink the tumors. You want to be able to address the growth that's really out there. I would say you're looking at beta-caryophyllene is one of the best ones that are for it. Myrcene is really good to address cancer. You also have a couple of terpenes like limonene and also linalool that have been known to really help as well. And then I've also seen some studies that talk about using pinene to really help with those. And by the way, these aren't products that you buy by themselves. They're in a combination, but you'll see a combination of those terpenes work very well for cancer. And by the way, I want to be able to take this question, and the next question is, does it shrink tumors? The answer is yes, it does. There's videos that have been done by Dr. Cristina Sanchez. She's a researcher in Spain. 26 years ago, the country of Spain built her a lab just to study cannabis and cancer. Now, she's done most of her work on breast cancer, although she has studied cancer in general. She has a lot of information that she's published in PubMed. She's also published a lot of information on YouTube. I think she's put out over 400 different studies on just breast cancer alone. So the answer is yes, it does shrink the tumor, because what it does is cannabis will go into your body, that neuroprotecting capability will go into your receptors. It'll coat the receptors, and it'll make sure that the cancer receptor, the tumor receptor, or the cancer receptor tumors do not get more energy than the normal cell. So what it does is by limiting the amount of energy or the amount of feed that the tumor get, it actually starves that tumor. And there's videos of this that are both done, that have been put out on YouTube from groups in Australia, as well as Dr. Sanchez in Spain. It's something that the United States really needs to hop on, because this is something that is a major breakthrough, but it's something that does in fact work. Your thoughts on this, Manny?
The only thing I could actually add to that is that there was another recent study or a course that I went through, I think with green flower, that actually also suggested in some studies that it blocks, instead of coating, not just coating as a neuroprotective for our cells, but it also kind of plugs, if you will, the receptors of the cancer cells so they can't receive onto the cells as you suggested. So not only just starving them out, but also making sure they can't spread otherwise.
Yeah, and I should point out we have a in our YouTube library, we have a video on cannabis, how cannabis and medical marijuana, how medical marijuana can help with cannabis. And I suggest that you go to the YouTube channel and watch that video. It actually has videos of the cancer and the cells being addressed by cannabis and being shrunk. So it actually shows this particular process being done. I think that's important to follow up. Next question are, what are the best methods to use cannabis to treat ADHD? Your thoughts, Manny?
So there's a few products out there. There's two that are kind of my favorite, and this depends on the level of it, what you need to do on a daily basis, if you're going to be going to work, dealing with family or so forth. So one of the first products I would recommend is our Calm 12.5 to 1 ratio product. That comes in a Theragel and a tincture, and it might come in a patch as well, depending on availability. And that's a high CBD product, low THC, so non-euphoric. You will not get high or stoned from it. It is very calming and helps with a little bit of focus. And then my next product from that one would be the 4 to 1, or excuse me, 5 to 1 Serene, which is meant for mental focus, clarity, helps with PTSD issues, anxiety, stress, a gambit of different symptoms, which I've seen in other consumers work also for ADHD. Now, there's also another product called a 1 to 1 Revive. That one I would possibly or more than likely avoid, because that can actually induce too much energy and hyper focus, which won't be too comfortable for somebody dealing with ADHD. So the 12.5 to 1 Calm, the 5 to 1 Serene, and then the 1 to 1 Soothe if you need a little bit more THC to help you.
Good, great. Next question is right up your alley, Manny. Tincture consumption ideas or tips?
So dealing with tinctures, the idea of a tincture is to be used sublingually under the tongue. And got Exploring Edibles coming up on May 29th. Pay attention to that one because it will go over that. But they're meant to be taken under the tongue and held there for at least maybe 30 to 45 seconds. So the mucosis of the mouth can actually absorb what needs to be absorbed. And you get the effect within 15 to 20 minutes. A lot of the tips that I like to point out is that if you're going to use tinctures or edibles or anything that you're going to ingest, always have a small snack, preferably a healthy fatty snack, avocado, peanut butter, or something to that effect, yogurt, just before. Or if you know you're about to have a big meal, have it right before the big meal. Tinctures or cannabis in general is a fatty molecule that needs to attach to something fatty to get into our system more efficiently. So if you take it on an empty stomach, particularly at night trying to go to sleep, you'll get the effect. It might take a little longer for that effect to kick in, but then you may get what I call a second wave the next morning when you actually ingest something again, and whatever's sitting there residually attaches and gets back into your bloodstream. So
Sure.
snack before, big meal afterwards. Try to keep it under the tongue for at least 30 to 45 seconds. And then you could also use tinctures topically if necessary, depending on the type of tincture.
Mm-hmm. That's good tips. Next question is a good question. What products are best for pain relief and sleep? If I've never used any kind of cannabis, you make a product specifically for sleep that's great for pain. Dream, right?
Yes, actually, Dream is going to be more for sleep only. Relief is going to be our 1 to 9 ratio. So 1 part CBD, 9 parts THC. Very potent indica category product that's meant for pain and relaxation and or sleep. However, if you've never used any kind of cannabis before, I would highly recommend starting low and going slow as usual. Our one-to-one soothe, which most people compare to a couple of glasses of wine when they're first starting out, and then you build a tolerance to that. And if that no longer becomes efficient after, I would say, maybe 3 to 4 weeks or longer, then start titrating up to relief, which will help with pain and sleep as well. The biggest
Sure.
benefit of that one-to-one stew, though, is that it's high in caryophyllene, high in CBD. It's great for inflammation. It's great as a natural analgesic or pain relief. It's great for the gut. It works for glaucoma. It's great for pressure. It's one of the products I recommend for everybody at least to try, if not start out at.
Mhm. Yeah, I think it's important to look at when you look at this. There's a couple of videos that are out there. One of them that we have in our YouTube library, the Getting Started with Medical Cannabis, as well as the Falling Asleep and Staying Asleep videos. Both are in our libraries. Excuse me. The Getting This Started with Medical Cannabis is a video we did. We have one coming up on May 15th on falling asleep and staying asleep. But there are videos on the YouTube library or in the YouTube library that also address sleep and cannabis. So it is a very effective. My counsel is if you've never used medical cannabis or cannabis in general, go get a consultation from Surterra. They'll help you walk through a lot of the elements, not only the products, but how to use them, and more importantly, how to journal them so you can actually find the best relief for you.
One tip also, Mark, if you're trying to fall asleep, it's probably best to use an inhalant or a tincture.
Yeah.
If you're trying to stay asleep, a tincture, an edible, or something that you're going to ingest, keeping in mind that when you ingest cannabis, it goes through the first pass effect. It converts from delta 9 to 11 hydroxy, which is significantly more binding,
Right.
lasts longer in the system. So you get that 7 to 8 hours of sleep that you're looking for.
Sure. Edibles are great for staying asleep, which is great. I'm a chocoholic. I have my chocolate before I go to bed. It says, please explain CBN and THC and their functions in the body. What are the benefits of THCA? I think we have a slide on this. Is that right, Lee? Yeah. You want to go over these, Manny?
Sure. So CBN is actually a byproduct or a degraded product of delta 9 THC over age and time. And it's more suitable to treat conditions like insomnia, relaxation. It helps with that. Anti-inflammatory, can assist with your rest quality, antibacterial, and it also helps with the onsets of ALS. It promotes bone growth and helps to stimulate appetite. CBN in the market of Florida is really hard to find. There's a few dispensaries out there. I know Surterra, we're trying to concentrate on that a little bit more as well. And that's because it's actually degraded THC or delta 9 THC. And to maintain that without mold, mildews, and so forth can be kind of complicated. I'm by no means a cultivar, but I do have some insight to that. THCA is the acidic form of delta 9 THC or delta 8 or any other form of THC, and it's non euphoric or non psychoactive. It comes right after CBG, and it's a great compound as a neuroprotectant, anti inflammatory. My son, who's a cannabis patient for epilepsy, uses it as a neuroprotectant and to help the effect to help keep the induction of seizures to onset. It's you can find it in a powder form. It's also great for MS, Alzheimer, and Parkinson's, and it helps stimulate appetite for some. Keep in mind though that you don't necessarily want to add it if you get it in a powder form to any particular hot products like coffee or cook with it, because then you can actually activate it and convert it into delta 9 THC. So whenever dealing with THCA, just be cautious when you're dealing with heat that you don't actually activate it, which is around 212 degrees Fahrenheit.
Yeah, that's a good point. That's an excellent point. Super. Let's jump on to the next question. I've had pain from neuropathy known as post-heptic neuralgia. Can this help and how? First of all, let me define what that is. What that is if you have had shingles, what happens is the skin where you have shingles become extremely sensitive, and that's what that condition is. The answer to your question is yes, it can help because what you're doing is you're, again, going through and addressing the inflammation, you're addressing the pain, and also there are ways that you can use some topicals, especially in the area where you had shingles, that can help be able to address both the pain as well as potential inflammation coming from that. Your thoughts on that, Manny?
I completely agree. I just be cautious on the type of product, particularly topicals, depending on the severity. But tinctures will work well sublingually, and vapes will work in titration. So you would use a vape for your breakthrough pain to help you right there in the moment, and then you would take a tincture or other edible or ingestible product to help you along the rest of the day, so you're not constantly having to inhale something if
Right.
you are willing to inhale.
Yeah, and whenever you're dealing with neuropathy or anything related to, especially nerve related conditions, stick to products that are high in CBD or have a ratio of CBD to it, because that'll help quite a bit. Don't go beyond the 1-to-1 and think that'll help. Right here. Your thoughts on that, Manny?
I agree completely.
Yeah, great. What product is good for daytime other than sativas? I think what we need to address is, what product do you need for relief, and how do we make sure that you don't get, let's just say, over energetic? Is that a safe way of saying it, Manny?
Yeah, that's a good way to say it, actually.
Yeah, I think if you take a look at the terpene profile, I think it has a lot to do with it. I know that there are certain terpenes that are very high on basically making sure you get energetic. There are others like mineral that get you to relax. The question is, what are you doing during the day? Do you need to be energetic or not? And if you don't need to be energetic, I would say stick to something like a 1-to-1 or something that maybe even is indica leading. Your thoughts, Manny?
Yeah, I'd agree. Sativas is just a very broad category of particularly more daytime products. But that's like saying, or excuse me, saying sativa, indica, or hybrid is like saying red wine, white wine, or rosé. You still
Right.
have a plethora of variety. And what you're looking for, to your point, Mark, is that if you're looking for something to be energetic, to get you really motivated and going, you would probably look for something really high in limonene
Right.
and alpha pinene. If you're just looking for something for focus, clarity, stress relief, but still not going to put you on the couch, you would want to avoid the combination of limonene and pinene together, maybe more of one or the other. But
Mm-hmm.
always keep in mind that the byproduct or the end result after your medicine wears off is that you will become drowsy and or tired. That's a sign that you might want to take another dose of that same product to kind of lift you back up.
Right. Cool. Last question is, what helps with seizures?
That is a very good question, and it's a very broad question because it depends on the type of seizures you're dealing with. But in general, it's been found that CBD works best for seizures, and using certain types of THC, such as THCV, which was previously discussed, or CBDV, which also works really good. But usually that's post seizure, that's after the episode has happened, and you use that more for the brain fog and clarity. So,
Right.
depending on what you're dealing with, CBD is typically going to be one of the better cannabinoids, but then you want to look at the terpenes as well. One of the really good ones is going to be our Serene 5-to-1, which is good on alpha pinene. It has a little bit of linalool and myrcene as well, but it doesn't have the double up of limonene, which also makes an impact. So,
Right.
in retrospect or in respect to that, there is a synthetic CBD product out there called Epidiolex that, under physician supervision, you can use in lieu of having a medical marijuana card. Although I don't necessarily uh, speak towards that or recommend that because I'm not big on the synthetics when you could get it naturally from the plant
Yeah,
and you can
I'm not a
actually get it.
fan of synthetics, period. Um, I think it's a nice gesture, but when you have a natural product, stick to the natural product. I do want to mention something you mentioned earlier. Seizures are really helped a lot by CBD, but also you mentioned a product that was like 4-to-1 or something like that. You still need a touch of THC to really effectively address seizures. Is that correct?
Yes, absolutely. I've actually found that, again, with physician guidance. My son is a medical marijuana patient, and he has access to 1-to-1s or slightly higher THC inhalants, not smokable flower, but vapes or tinctures. And
Mhm.
it's shown to have a significant impact on when he would have them maybe once or twice a year. He's gone almost a year now without them. So it does make a huge difference, whether it's in the same product, in a ratio product, or you're using them in tandem.
Sure, that's great. Let's jump into some questions that were asked during the webinar that's really come up. Joel asked the question, why do people use cannabis? And again, we have a webinar we did about a week ago on getting started with medical cannabis. I recommend that you take a look at that. I think people use cannabis really for three reasons, and this is my approach, and I'll let you answer this too, Manny. One, they're looking for relief for a particular medical condition. They've had this medical condition, they've tried a number of alternatives, whether it's pharma or not pharma, they still have it. It's not going away. And what they want to do is they want to have something that can help them with their arthritis, that can help with their pain, that can help with their inflammation. That's one of the main reasons why people use cannabis from a medical standpoint. I do have to mention that when I grew up in college, a lot of people use cannabis candidly, like people use 151 Bacardi or alcohol. They use it to get high. And that recreational side of cannabis is all about that. Just being able to try to just use it to be able to relax or to enjoy it. And that's legitimate. You know, there are people that really want to do that. And I think that's great. I think the third reason that people use cannabis is because they're at the end of their rope. They've really gone in and tried a lot of different things. And they found out that by talking to people and by using cannabis, it has, in fact, provided some relief for some people that they work with or they know or in their support groups. So that's what I typically see. What do you see, Manny?
I see a lot of the same, Mark. Primarily, people come in to use it as a last resort. To my opinion, I wish people had more availability so they would use it prior to getting into synthetics. And that's not to say that pharmacopoeia doesn't have a place for what they do. There's a significant reason why we have pharmacopoeia. But people use it for relief, from stress, anxiety, from pain, from you name it. And by word of mouth, they're realizing that they can achieve these goals, a better quality of life without all the side effects that they do get from pharmacopoeia if they can get it from cannabis.
Sure. Great. Chris asked a great question is, can cannabis help me? I just had a stroke. The answer is yes. I'm going to have you answer some of this, Manny, but I do want to point out there's been studies done in Israel that really show what the stroke is doing to a person is affecting the receptors in the brain, damaging some of them, and really inhibiting some of the receptors. What happens when cannabis comes into play because of the neuroprotecting capability, it helps to rejuvenate, it helps to bring some of them back. It may not bring it back 100%, but it helps to be able to put people back on a path of recovery. I think high CBD products, although you do need a little bit of THC, makes some sense. But it's not going to be something because of the stroke. It's not going to be something where you take a pill and tomorrow it's over. This is something that's going to take a period of weeks, if not months, to really help you recover from that stroke. Your thoughts, Manny?
For me, I agree, Mark. And as a non-medical professional, what we advise most people or patients that come in is to try to treat the symptoms or try to assist the symptoms that you're dealing with, not the actual diagnosis. And that tends to help us alleviate the question marks that people have on trying to figure out which products will work for them. Because to me, if you tell me the same thing, the same question, I just had a stroke, how can this help me? My first question is going to be, well, what symptoms are you dealing with? What do you
Right.
want to do better in your life? And that's how we would address that.
Yeah, and I do want to answer this. There are studies that have been done in Israel. There's studies that have been done in Canada. I follow this pretty closely. My father had a stroke, and I try to help him with medical cannabis. It's really a matter of how does your body recover. It really depends on the type of stroke, where the stroke took place, and that's going on. But I think the answer is it can help. But again, you always use it in combination of working with your medical doctor to make sure that the pharma drugs and the cannabis drugs work. They play together nicely. Your thoughts, Manny?
Yeah, I completely agree. There's only one question actually I might have that you can help me out with, Mark, is that I know that if you're dealing with strokes or any heart conditions, a lot of the times there's blood thinners involved, and from
Yes.
studies and things that I've gone
Yes.
through, you want to look out for certain CBD products as well, and that's why it's so important to work hand in hand with your physicians because CBD can act as a dilator as well, and you don't want to
Right.
drop your blood pressure.
Yeah, be very careful of the blood thinners because that's what can cause some problems. But again, cannabis can be used, and in fact, in working with much like with cancer, cannabis working with, for example, a lot of the treatments that they use for cancer can really help the patient recover. But it's a combination of the doctors working with your medical cannabis doctors to really get the formulas right for you. And I think again, cannabis is just individualized, and that's what really makes it makes it something that each person will be different, so we have to monitor it on a personal basis. Next question is, what do you recommend for glaucoma? Manny, there's a lot of different cannabinoids, right?
Absolutely. One of our favorite products for glaucoma is our one-to-one soothe. One part CBD, one part THC, and that B caryophyllene. Again, CBD working as a dilator, helping more blood flow through the eyes. And it seems to work great for just about everything else dealing with inflammation, stress, and
Sure.
pressures. So one-to-one soothe with CBD and THC, and then B-caryophyllene as a terpene would be my recommendation.
And it works very effectively. I know that my mother swears by it. So there we go.
Mhm.
Next question is, what is the best way to ingest THC, CBDA, and CBD? I think really it's a matter of what's the route of administration that you are comfortable with. Your thoughts, Manny?
Yeah, what are you looking to work with here, or what are you trying to improve? If you're looking for longevity, you would want to consume THC, CBD, and or CBDA via Theragel, which is like a pill, sublingually, which is your tincture. If you're looking for just breakthrough, you would want to inhale it, but then you're not going to necessarily have CBDA and CBD depending on your method, because as soon as you apply heat, that CBDA converts to CBD. So this would be more of come in, talk to us, let's have a consultation, let us get to know you a little bit better, get to know us, and we can figure out what really you're trying to tackle and get you products that will be efficient for that.
Sure. Next question is a really good one. What cannabinoids are best for pain, anxiety, depression, and PTSD? Manny, you've worked with a number of patients that have these conditions.
Had a few of them myself as a patient, and cannabinoids, again, the two major cannabinoids that anybody's going to really see in a lot of the products at any dispensary is going to be your CBD and your THC. If you look at the COA, you'll see CBC, CBDA, THCA, THCV, all the other minor cannabinoids, but in very small percentages. So when you're dealing with pain, particularly, again, depending on the type of pain, chronic, acute, or otherwise, you may want to use high THC products initially while you implement CBD over about a week or two, and you should start noticing you may not need THC as much. Anxiety is going to be more of CBD, THC as well, depending on the terpene profile and depending on the type of anxiety.
Mhm.
Depression, I would definitely go look at terpene profiles, particularly alpha pinene and or limonene, depending if you want to be energetic or not. And then same thing for PTSD. And just to make it even easier, because I know that was so easy to understand, is that we have two products that I would recommend for one or both of all these symptoms. And that one of them is 5-to-1 serene, which is great for depression, PTSD over time. It'll be good for pain because it's great for inflammation and it's great for anxiety. However, if you need something a little bit more, like I said, with that THC, to start, one-to-one soothe would be great. And then you can work your way up to higher products. And as I suggest, a lot of our wellness line and ratio-based products, that's not to say that we don't have chemovars or strain-based products that you would find at every other dispensary. Again, the difference is that our wellness line is consistent. We want to find which terpene profiles and cannabinoids work best for you. So that way we can recommend some of these chemovars or other strain-based products that might be also beneficial for you as well.
Yeah, that's a good answer. Let's run into the next question, which is, does cannabis products need food or fat to work better? Yeah, I think you addressed this, Manny. The answer is yes.
Yes, depending on the method or route of administration you're looking. If you're inhaling it, you don't need that to be available. If you're ingesting it sublingually, orally, or as an edible or otherwise, you definitely want to have something a little fatty in your stomach. Again, a small snack right before, because the more material that's in your stomach, the longer it's going to take to go through the first pass effect and get through your liver and convert it into 11 hydroxy. So a small snack right before, if you know you're about to eat a big meal, have it just before a big meal. And the reason I say that is because you don't want to go to bed on a full stomach, but maybe having a little scoop of ice cream, a cup of yogurt, peanut butter cracker, or something like that may be beneficial to have just before you take your medicine to sleep, because then you'll find you'll sleep significantly better and you'll avoid that second wave of euphoric effect, depending on the product the next morning when you do eat.
Yeah. Next question, Lisa, is a great question. If marijuana is legalized in Florida later this year, will the marijuana be different and better? That is a most excellent question. And the reason I say that is because I don't think dispensaries, and I'll let you speak from a dispensary standpoint. I don't think the dispensaries are going to do anything different with respect to making products testing products and putting the best quality product out on the market. I think that's going to continue to continue. Dispensaries in Florida do a great job. They're regulated. They do 2 tests in-house, 1 test outside from a third-party firm. So you're going to get, from a medical and cannabis standpoint, you still should be able to get the best quality products and be able to get some higher THC-related products for issues related to like PTS, head injuries, pain, things like that. Now, let me say, is it going to be better? I think the answer is going to probably be no. And let me tell you why I'm going to answer no. The current administration in Tallahassee is anti-cannabis, anti-medical cannabis, and has been doing everything they possibly can to water down the product that you get to be able to address your situation. When you are as a physician, when I take a look at, and I'm a practitioner, not a physician, but when I take a look at working with people, I'm looking at certain ratios of certain milligrams of THC to CBD to be able to provide the best relief for them and to test that and to journal it and to follow that. If you cut back on the amount of THC in the product, the customer has to buy more product. And that's what they're really pushing for. Especially in the South, a lot of the red states have done things like limit the amount of marijuana. The Texas program and the Georgia Tech programs, candidly, are nothing but glorified CBD programs. Okay, well, that's what they're going to try to do here in Florida. And I think the best way to do is for us to push back and have the people who supposedly represent us listen to what we want and provide us the best possible quality product. And candidly, stay away from trying to act as doctors and scientists. Listen to the professionals who have come out and actually lobbied strongly. Doctors in the state have lobbied very strongly to provide the same level, if not higher levels of THC, to be able to provide the product to the customer that they want. I don't think the product from a dispensary standpoint is going to be different. I think the problem that we're worried about right now is the politicians are already doing everything they possibly can to really destroy the medical marijuana program here in Florida. And I think that's something we got to be careful of, because under the guise of making it recreation, they're going to try to come out and use this as a legal angle to be able to really hurt our program. Your thoughts, Manny?
Yeah, that's one perspective that I haven't really looked into, as far as the politics of it. That being said, as far as different or better, it's subjective, I would say. Right now, every dispensary has certain tiers of flower that they sell at different rates, whether it because of the size of the nugget or the flower or what have you, depending on what they want to suggest. So I wouldn't suggest better. I think the medical side of it is always going to be top tier. It's highly regulated. As far as the recreational side, I feel that it's going to fall or depend upon the regulations that fall into place. Because let's say they do cap the rec side at a certain THC percentage. For instance, Surterra has premium flower, and then we have Florida Depth flower. Because of the methods it's grown, it's sold at different price points. If we have flower that falls under a certain percentage, where we normally might get rid of it, we might keep it for the recreational side. So it all depends on how regulations are going to fall, but the quality and the top tier products that we provide now are not going to go away, and they would only hopefully get better regardless of what passes, regulatory or otherwise, because we're always trying to improve our products for the consumer.
Yeah, I think that, first of all, I think the chances of this passing is very high, since 70% of the population is in favor of medical cannabis. I think the biggest problem we're going to run into, again, is going to be the politics around it, the regulations. And I think the medical program, hopefully they'll just keep their hands off and just let it run as it's running. But I just, unfortunately, I do get involved in the political side, and I don't like what I see with those folks. They're not listening to the public. They're not listening to doctors. They're not following science. And I'm sorry, I demand that they represent me. I don't represent, they work for me. I don't work for them. And I'm going to demand that they do the job that they've been paid to do. And I know that they're not going to like what I say, but that's my position. And I think every person deserves the right to be able to have them be our public servants, which is what they're supposed to be. Okay, let's jump. We had one last question that came in. I don't know if you want to take that or not, Manny. It says, can you strictly go by terpene charts or combinations of trial and error for the best way to go to find the right profile of individual solutions. We have a webinar that we did on dosing that I suggest that you take a look at. The answer to your question is yes. When you cannot, I cannot prescribe for any person the products that you should use because, again, like alcohol, like caffeine, cannabis is a very personalized product. Going through a dosing regime, keeping a journal, working with medical professionals will allow you to do, in essence, a little trial and error, but to be able to try the different products to find out what works for you. The answer is trial and error is part of it, but it's not, doesn't take forever. I mean, I've found my dosing level within 2 weeks. Most people do. I know in certain cases where you have things like Parkinson's, it may take longer, it might take 2 months or 3 months. But the point is, the answer is yes. I would use some of the charts to start, but I would get a consultation. I would work with my medical marijuana doctor, and I would keep a journal to be able to figure out what's best for me. Your thoughts, Manny?
I completely agree, and I'm surprised I forgot to mention that throughout this webinar this evening, is that journaling is by far the most critical thing you can do on your journey. That said, finding the right terpenes, that's why I always emphasize the wellness line, a ratio-based product from Surterra, because of the consistency. Because
Right.
let's say you don't do that and you go into the chemo bars or what most people call strains off the
Mhm.
bat, and you find success. Hopefully you do. The caveat is that those batches change and or could be seasonal depending on how that grow is doing.
Sure.
So finding a ratio-based product that's consistent is going to give you a terpene profile, a cannabinoid profile, a recipe, if you will, on what to look for in further products, whether it's at Surterra, whether it's at another dispensary. So again, like you said, Mark, the answer is yes, journal and have that consultation.
Right. Well, first of all, I want to wrap this up, Manny, and I do want to mention with 420 coming up, there's going to be a lot of deals going on. I know that there's no exception, Saterra is going to be part of that, right?
Absolutely. I'll go over this slide one more time and point out some of the big ones. Starting right now, if you spend $420 before 420, you're going to get a $50 credit that's going to be provided through the app, our loyalty program, to be used in May. We're going to have extended hours on Saturday, 420, so we're opening up at 9 instead of 9:30, and opened up till 8:30 instead of 8. Then on 420, we're having some of those big grand prizes. I went over some of the devices that can be given away. We're also going to be giving away 1 gram prize of a half an ounce of flour. The second, a quarter ounce, and the third will get an eighth of an ounce of, or an eighth of flour. I know a lot of people are big on flour. That's why I wanted to point those out. But please ensure that you enroll in our loyalty program. And you can get that through our website, Surterra.com, or you could download it through the App Store or the Google Play Store as well.
Yeah. Look, I think that because cannabis isn't covered by insurance, it comes out of your pocket. Anything you can do to save money is important, and this is a good time of year. I do want to point out, Manny, one thing, and that is when you go to stock up on products, buy enough products that you can usually within 6 to 9 months, because really, if you try to buy something and try to keep it for 2 years, it may not be the best approach.
Yes, absolutely, and particularly flour. Me personally, I don't like to hold flour for more than maybe about 2 months, and that's storing it at optimal conditions. Low light, cool room temperature, having humidifier in there to keep it from getting that jar rot or otherwise. So don't overindulge. I use PAF, push away from the table, and try to get what you need or that what you know you're going to use.
Right. Well, listen, I want to thank everyone for joining us. It's been a long webinar. We've done a lot of different things. Please join us. We're coming up next week. We're talking about anxiety and stress. The 15th, excuse me, on May 1st, anxiety and stress. Then sleep. We're talking about edibles. We're going to talk about terpenes. Really talk about the actual products that can help you with your various conditions. We're doing a medical program, the overview of the medical marijuana program, and we're also going to be talking about some new products from New Horizon Wellness, specifically weight loss, for example. But please come and join us. I want to thank you for joining us tonight. I do want to thank you, Manny, for not only Surterra sponsoring this, but for your work. Some final thoughts?
Just that, thanks for having me. I'm always glad to share my knowledge and gain knowledge from you as well, Mark. I hope that we were able to reach out to some people. And if you're in the area or near Surterra, or if you have to make a drive, come see us. We'll be happy to sit down and talk with you. And if you're not on the right track, get you on the right track, or at least get you started and have some understanding. Thank you for joining us, and thanks for listening to me.
Manny, you have a great 420, and everybody, please enjoy your 420, take advantage of the discounts, and thank you very much for joining us tonight. And I look forward to having you join us on May 1st.